Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
The day is Tuesday. The subject is healthcare and what you can do to improve yours. And the topic that we are tackling today is bad breath, certainly something none of us want. Dr. Jitka Lom from Express Care here once again. Doc, some great questions submitted by the community on Facebook. You ready to go?
Ready to go.
All right, here is your medical degree put to the test. And question number one, Dr. Lom, what's the difference between gingivitis and halitosis?
Oh, that's a good one. Gingivitis is gum inflammation. So gum inflammation could lead to bad breath, often does, but it's a separate condition, and that's one that you need to talk to your dentist about. Again, gingivitis can come from poor hygiene or not brushing, especially flossing, and then from certain health conditions, medical conditions, including diabetes.
Now, of course, you are a general family practice physician.
Yeah.
At what point do you ever hand this off to a specialist or something
We
like that?
do, either to maxillofacial surgeon. Sometimes if somebody has, an abscess in their mouth, that can also have a bad odor, or of course to the dentist.
Okay, well, question number two, let's keep on rolling. What types of mouthwash, Dr. Lom, are best for bad breath, and what is an antiseptic mouthwash?
Okay, just like you were saying. So there are some mouthwash products that are just sort of like a rinse, just to smell nice, and then there are some that have bactericidal chemicals in there, and you can look for those. The ones that are antiseptic kill bacteria, but they're also more irritating to the mouth, so you may sometimes want to dilute those or rinse out with water right after them so that you don't have the chemical irritating your mouth, causing dryness, aggravating your problem.
Could you possibly use both? Because I know that the antiseptic ones, back to back, perhaps.
Yeah,
okay,
sure.
Because the antiseptic ones
don't usually smell that nice.
Yeah, and but the peppermint ones,
yeah,
the long-lasting ones, those are great. I speak from experience here, obviously.
Another thing you can do is use natural products, such as just chewing on mint leaves or parsley. Parsley is very cleansing to the mouth.
Parsley also tastes kind of funny, but
it does, but
it does the trick.
It does the trick.
And that's what it's for, definitely. Okay, question number three, and beautifully segue, because are there any natural foods that can help with bad breath, specifically with celery?
Oh, yeah, celery would also be another one, and cardamom. You can chew cardamom after your food as a digestive.
I have no idea what that is. I'm just a lowly journalist, so you need to explain.
It's an Indian spice. It's they're little seeds. Probably you can buy them in a health food store. And you just chew them. They taste a little bit like licorice. Yeah.
After the show, let's go out for some cardamom. All right. Okay, question number four. Smoking and coffee create bad breath, Dr. Lom. What do you suggest to freshen the breath? You talked about smoking and its contributions to halitosis.
So smoking, for those multiple reasons, the smoke itself, the dehydration, the alcohol, again, as a dehydrative sort of thing, and same with coffee. Okay, that's why you tend to get coffee breath, because it dries out your mouth. So rinsing with water, drinking plenty of water afterwards would be good. Of course, quit smoking, and mints may help a bit.
Would not flossing between the teeth for extended periods of time also lead to halitosis?
Certainly, for sure.
Because it leads to the infection of the gums?
Infection, yeah, just a low-grade infection, little bacteria left in there. And remember the biofilm, basically it's like a bunch of goo stuck on, so you need to brush it off or floss it off or jet it off.
Right, do not neglect your gums. I remember hearing that in Pretty Woman. All right, what are we up to? Number 5, here we go. How important is cleaning the tongue? We talked about this. Do you recommend a tongue brush? And if so, what kind?
Oh, no, just your regular toothbrush will work. You might want to choose one that has the soft bristles, like for children or babies. Be a little easier on your tongue so it doesn't hurt. And then just trying to go in all the areas, especially at the back and your tonsils, turning the brush upside down and brushing your tonsils.
Now again, I am not a smart man, Dr. Lom, but if you brush your tongue and brush your teeth and everything like that, even if you rinse it really well and everything like that, even with hot water, would you not be just putting the bacteria back onto your teeth and tongue the next time?
That could happen. Well, hopefully you'd rinse out your toothbrush, but it's a good idea to clean your toothbrush. Of course, after you brush, you should rinse it off with water, and if you have a really big problem, you could put a little peroxide on your toothbrush to clean it, and change your toothbrush at least every couple months for sure. But what you're doing is you're disrupting that biofilm that we were talking about, and then your saliva and water and whatever you drink will help rinse it out of there. So what you're doing by brushing is actually disrupting that film.
Oh, okay, good to know. You interrupt the supply chain, basically.
Yes.
All right. Can you tell I went to business school? All right. Another question: does using baking soda for toothpaste really work? It's marketed pretty aggressively.
It does work really well. It's an abrasive, a mild abrasive, and actually sometimes people are sensitive to their toothpaste. They develop allergies to their toothpaste. It's pretty common actually around the lips and sore, dry lips from toothpaste. And so you can just take a little bit of baking soda, mix it with water, and you'll have a little slurry. It doesn't taste very good. It's a little salty kind of tasting, but it works really well to clean the mouth. Also, it's alkaline, and that will help inhibit the growth of bacteria. When you drink sweet or acidic foods, you'll tend to have worse breath than if you eat alkaline foods, basic things.
All right, and we kind of talked about this already, but does flossing help prevent bad breath as well?
Yes, it definitely does, and get all the way to the back.
All right, well, if you have any questions for Dr. Lom, is there anything you do not know about medicine?
Many, many things.
Well, we've covered like a litany of them, so you know what, tell you what, everybody, send in your topics, and the good doctor will definitely be up to the challenge, and we will be here right every single Tuesday as we are. Doc, thanks a lot.
Thank
as
you.
always.
Thank
All right,
you.
and stay tuned. We'll be back after this.
Okay. All right.